You probably know that some people with certain health conditions are more at risk for the serious side effects and even death from getting COVID-19. These conditions include high blood pressure, COPD, obesity, and diabetes. However, a recently published study shows that people seem to be getting diabetes after they've had COVID-19. Is COVID-19 causing diabetes? We will be looking at the study today to try to answer that question. Good morning, health-minded people. I'm Dr. Snow, and I teach you to be in charge of your own health because other than God, no one knows as much about you as you do. A recent meta-analysis, which just means that the scientists looked at many studies, then combined all the results into one report. This study was published in the Journal of Diabetes, Obesity, and Metabolism that looked at 8 studies, 4 in China, 2 in Italy, and 2 in the United States. What they discovered was that patients who were being admitted with COVID-19 without a previous diagnosis of diabetes were developing high blood sugar and ketoacidosis, a serious condition found most often in patients with extreme high blood sugar. In fact, what they found was nearly 14% of COVID-19 patients that were admitted to the hospital developed new onset diabetes. This is a significant number. However, the 8 studies had a combined total of 3,700 patients admitted to the hospital, and about 530 developed diabetes. So far, this is a relatively small group considering there have been over 116 million cases of COVID worldwide. The authors of the meta-analysis gave 5 theories as to why COVID-19 may be causing diabetes to appear in patients. Number 1, the virus may be attacking the beta cells of the pancreas. Beta cells are where insulin is made, and destruction of these beta cells is what happens in type 1 diabetes. So far, studies on whether or not COVID-19 is capable of destroying beta cells has been conflicting, so more research is needed. Number 2, the virus may be attacking other parts of the pancreas, causing inflammation and decreasing the pancreas's ability to produce insulin. Again, we need more research to determine this. Number 3, just being very ill can cause your blood sugar to go up. It is not uncommon for non-diabetic patients to require insulin after major surgery or during severe illnesses. Once the issue is resolved, most patients will return to their previous normal blood sugar and will no longer need insulin. If you're learning something new, please click that like button. Number 4, COVID-19 is treated with steroids to decrease the inflammation the disease causes. Steroids commonly cause an increase in blood sugar, and patients who need them for more than a few days, especially at higher doses, are often given insulin to keep their blood sugar levels normal until they can be taken off the steroids. By the way, these are not the steroids used for bodybuilding. Number 5, the patients diagnosed with diabetes after they got COVID-19 actually had diabetes before, it just hadn't been caught yet. Diabetes can have few or no symptoms until it gets completely out of control, so it could be that while COVID-19 led to the diagnosis, it didn't actually cause diabetes. The authors of this report have set up a registry to gather information from around the world. They are collecting data from healthcare professionals on patients diagnosed with new onset diabetes soon after a COVID-19 infection, with the hope of understanding this issue more fully and possibly preventing it in the future. If you're a healthcare provider and would like to register with the Global Registry of New Onset COVID-19 related diabetes, I will leave a link in the description below. So what can you do to avoid getting COVID-19 and possibly diabetes? Support your immune system with good food, good sleep, and wash your hands often. Keep your weight under control and go for a walk. Exercise will help you to keep your blood sugar in the normal range. And don't stress out about it. Stress can increase your blood sugar and it weakens your immune system. Stress does not serve you, so avoid it. Be smart, but don't be stressed. If you have found this information helpful but want more information on diabetes, click and watch this video now. Thank you for joining me today to learn about the connection between COVID-19 and diabetes. Stay healthy, keep your blood sugar under control, and have a blessed week.